Hi, my name is Steve Hodgson. I'm a physiotherapist and director at Hallamshire Physiotherapy clinic in Sheffield. Today I'm going to talk about foot pain. Especially regard a lady I've just recently seen who presented with pain on the top of her foot. So this is the toes, and this is the pain, the area she was having pain. So it was a right foot. She's a 70-year-old lady. She was presented with foot pain. She saw a GP. A GP said it's probably arthritis, and she had an X-ray. The X-ray showed degenerative changes in the top of the foot. So these joints showed some changes. Now, in 70-year-olds especially, you will find that a lot of the joints would actually show some degree of degeneration, which actually isn't degeneration. It's just a normal aging process. As we get older, our bodies change externally as well as internally. Joints will change. And a lot of what we see on our joints, especially on X-rays, are perfectly normal. It's just a change for somebody who's got to 70. You'll see similar changes on people with each decade as you're going from your 20s to 30s and forth. The incidence will increase of what is seen as degenerative changes. However, it often normal changes. And we know this because of when you look at X-rays on people who've never had foot pain or back pain, you see similar changes in the group of the population who doesn't have pain, who do not have pain. Okay, so view any X-ray changes with a large pinch of salt, and unless you've actually got a fracture, they can be of limited use. The foot pain, in this case, this lady's pain, was on the top of the foot. There's a degree of swelling. It was painful, and when that happens, you're asking, well, why has this happened? If you look at the lady, she's got quite a tight foot. She grabs the floor, and what's happened, she's taken up Tai Chi in the recent months, and what she's doing, because she's struggling with the balance, she's starting to use her toes, a bit like a blackbird's foot. She's grabbing the floor. She's grabbing the floor, which is causing increased pressure through here. So she's tightening the foot up, and muscles exert a huge compressive load through the joints. And if you're doing that, you're going to get sore joints. You've not got arthritis. You've not developed arthritis at the age of 70 from standing on it. But what you're doing is making the joint do something it's not used to. You'll see this with any group of patients where they've increased in activity too rapidly, or they're taking up new sports which they haven't done. Even at the age of 20, 25, you will see these things. In this case, this lady's case, as soon as you changed how she used her foot and got her to use other muscle groups and joints, the foot pain started to go off. Within a very short period of time, within a few days, you started to find the foot was relaxing more, she was more comfortable. But more importantly, she had an explanation. She knew that she wasn't developing arthritis, and this is the end of her walking, and that's got implications looking after her husband and various other things. So it's very important to not just look at people's feet, but look in context about what's happening above the foot, what's happening the knee, the joint, how do they use the joint, and also what do they think that's going on. So this link between your body and the psychology is fundamental to changing people in terms of why we sometimes struggle to get better. And this is the sort of patients that we see on a regular basis at the clinic. So if there's any questions, ring the clinic, but we'll be doing a series of these talks over the next few weeks in different areas, so looking for the next one. Okay, thank you very much.